what is the bad things about it?
Yeah, I mean, that's what I'm thinking when you're going over the good things. I feel like the bad things can outweigh.
But how long a bridge averagely lasts, you think?
With excellent home care, I mean, 7 years, 10 years.
I mean, let's be
optimistic. 10 years or more.
10, I would say 10 is a good number.
But most of my patients they're on a lot of medications that cause dry mouth. A lot of medically compromised patients that just don't have the saliva they used to. One part of the bridge goes bad, you lose the whole bridge. Dr. Omar mentioned before, if you have two healthy teeth, you're already compromising two healthy teeth. They're hard to, I'm still going with the disadvantages. Yeah. They're hard to clean under, so you have to clean underneath it. And also you're not retaining the bone here. So anytime the bone loses a tooth, the bone says, hey, I'm not needed anymore. There's nothing here for me to do. And it starts to shrink away. And that can actually affect the bone on those adjacent teeth. It can lead to more bone loss. So there's a lot of things to think about. And you have to look at the patient behind the mouth. And it's going to depend on the patient, because in some cases it can work great.
You reminded me of my wife. So my wife, she was born with 2 missing teeth.
Oh yeah.
The bicuspids, and she wanted bridges because she hated the idea of putting a screw, in her mouth. She hated it. She didn't like it. And what I told her, I said, listen, this was our first month getting married. I was like, listen, I'm planning to keep you longer than 10 years.
He's like, I know.
And I want to do a treatment that lasts you for the rest of your life. And a bridge, I know I'm going to dealing with it in 10 years. And the issue with that is, yes, it lasts 10 years. Yes, it's way more affordable in the first 7 to 10 years. But what happened is, you start getting cavities in these two, and may end up needing root canal, and actually may end up losing one of them. Most of the people we see, they wait too long, and then now you're gonna lose, 2 teeth, for example. Then it's getting more expensive to fix the problem, because instead of needing just 1 implant to replace the space, now we need 2 or 3 actually.